Generics Radio on 90.7 WCLH, Wilkes-Barre, Scranton, Hazleton. Keep it locked. My name is Bryce, and I am one of the co-hosts. I am a pharmacy student in my second professional year of the pharmacy program at Wilkes University. This is my fourth year overall, with 2 more to go after this. I have an interest in psychiatric pharmacy and industry pharmacy. I'm not sure which route I want to go down yet, but maybe I can find a job that utilizes a little bit of both areas.
My name is Jamie, and I'm the other co-host of our Generics Radio show. I'm also a student in my second professional year, just like Bryce. I also am not quite sure what I want to do when I graduate yet, but I am interested in working with patients, so I'm thinking about a job in a hospital or clinic setting. I have a passion for neuroscience and psychology, so I hope to incorporate those as well. And with us, we have Dr. Thomas Franco, an associate professor of pharmacy practice here at Wilkes University, Nesbitt School of Pharmacy. He has been invaluable to this show, serving as the weekly licensed pharmacist and advisor for our Operation Substance Use Disorder chapter here at Wilkes.
I am happy to be back. This is the first time I'm sitting in this chair in almost 2 years. So I'm happy to work with you guys. We got a lot of great stuff planned. Really excited to get going with this.
Yep. As Dr. Franco said, we'll always have a licensed pharmacy faculty member with us on the show to ensure accurate information goes out to you. And we are here to bring you weekly topics centered around the opioid crisis, proper medication use, and disposal in not just my community, your community, or our listeners' community, but it is all of our communities. Be sure to tune in every Wednesday afternoon from 1 to 1:30 p.m. right here on 90.7 WCLH for new topics and discussions.
I think we're going to have plenty to talk about. It's been 2 years, and in case you haven't noticed, there's kind of been some stuff happening for the last 2 years. And that stuff has really taken its toll on people with substance use disorder, and there's a lot that we as pharmacists can do, and we can educate our patients on and the public on, and we have plenty of topics to go through for the next few weeks. But more on that to come. We'll keep people on their toes as we get ready for that.
Yeah, I agree with Dr. Franco. We're going to have a lot to talk about over the next couple weeks. But before we get started with that, we wanted to thank our previous Operation Substance Use Disorder Chair, Hunter Maxwell, who won't be here this year with us. He is currently on his advanced pharmacy practice experience rotations and finishing up the last year of pharmacy school. We are very grateful for his efforts with last year's show and the new podcast he started, The Saturday Pharmacist. He led our chapter to a regional win last year, and we wish him the best.
I'd also like to give a quick shout out to one of our previous chairs, Harrison. I used to work with Harrison when he was still a pharmacy student, and he did a lot to motivate me, and he's now on to bigger and better things working as a resident in Pittsburgh. Harrison was one of the biggest influences on me becoming co-chair of Operation Substance Use Disorder and my interest in substance use disorder. We wish you the best with all of your professional endeavors, Harrison.
We really do wish both Hunter, well wishes as he continues his last year of school, and Harrison being too cool for school as he's now out in Pittsburgh. And really, those guys did so much to help get the program up and running. Harrison in his year and Hunter with the podcast last year. And you guys are going to continue what's growing into a strong legacy. So I know we're all excited to hear about what you guys have in store as to how we're going to elevate the show to the next level for your year and beyond.
Yeah, we're really excited to be here, and we still reach out to Harrison and Hunter, and they help us a lot with carrying on this show. So for those of you who don't know or may need a refresher, Operation Substance Use Disorder is an organization focused on promoting safe medication practices for people of all ages. It started through Ohio State University School of Pharmacy and the Cardinal Health Foundation. The American Pharmacists Association has an Operation Substance Use Disorder chapter within most universities in the Academy of Student Pharmacists. Given the focus of safe medication practices, this year we're going to cover a variety of topics, including the opioid epidemic, naloxone, substance use disorders, and so much more. We've touched on many of these topics in our shows previously, and we're going to revisit some of these as the topics are ever changing.
I think one thing that I'm really happy about is that with everything that has happened in the last 2 years, APhA has continued to invest in Operation Substance Use Disorder. And I just had a conversation this morning with some folks at APhA There's a lot of topics that are going to come to the annual conference, which don't know if you guys are going to go to it, but you totally should. And we're still planning to have the Utah program this year, which, again, you guys should totally go to. So kudos to APHA. They've recognized that this is an ongoing issue, that being substance use disorder within the country, and they're doing everything they can to empower pharmacists to be part of the solution to that.
Yeah, speaking about the conference, I actually happened to go to the virtual conference last year, and even though it wasn't in person, I felt that it was still very life-changing and really changed my perspective on a lot of things related to substance use disorder. And as Jamie was talking about, some of the core messages of Operation Substance Use Disorder include only using prescription medications as directed by a health professional, never share your prescription medications with others or use someone else's medications, always store your medications securely to prevent others from taking them, and properly dispose of medications that you no longer need, and be a good example to those around you by modeling these safe medication taking practices and discussing the dangers of misusing prescription drugs with your family, friends, colleagues, students, or patients. Since Generation RX started almost 10 years ago, it has spread across the nation via countless APhA-ASP chapters. With over 140 schools and colleges of pharmacy in the United States, that's a lot of student pharmacists with the same goals, educating a lot of people. At Wilkes, we are always looking for new ways to engage the community and bring educational topics to you. This radio show is something we are so excited for and can't thank everyone at Wilkes, and especially WCLH, for making this come to life. We hope you enjoy our topics and content that we bring, and hope you will encourage others to keep it locked on 90.7 WCLH2.
So going off what Bryce said with our core messages, we wanted to talk a little bit about what substance use disorder is. So our operation, as we mentioned before, seeks to educate patients on the dangers of misusing prescription medications. And there are several ways that medications can potentially be misused. Some of those include taking more of a prescription medication than prescribed, taking a prescription for a reason other than prescribed, or using a prescription that isn't written for you. This includes far more than just prescription medications, though. Opioid pain relievers are still one of the most misused prescription medications currently, but you also may take some non-prescription medications, and over-the-counter medications can fit into this category as well and have the potential to be misused. In the U.S. alone, an estimated 16.3 million people over the age of 12 will misuse prescription drugs every year. The potential dangers of misusing prescription medications can include accidentally or intentionally taking more than prescribed, which is the highest cause of accidental death in the United States. Additionally, more visits to the emergency department are due to bad reactions to prescription medications such as breathing emergencies, leading to tremendous costs on the healthcare system.
I think one thing that was interesting that you brought up there was the over-the-counter and non-opioid. You know, everybody thinks that it's opioids. Opioids are the big thing, and that's true. I don't want to diminish that, but we know that since I want to say probably around 2013, the overall prescribing rate of opioids in the U.S. has steadily declined. Now it's nowhere near where it was, say, in the early 90s, but it's on its way down. And we're still seeing people run into issues. I think even taking a step back, though, when we think about over-the-counter medications in the last 2 years, we see that there was a lot of limitations in accessing care for patients. I don't just mean for substance use. I mean for anything. Everybody thought that they either had COVID or they were afraid they were going to get it. And there was not a lot of going to your physician from a sinus infection to a stubbed toe. So what were people doing? They would go and they would find stuff over the counter, be it anti-allergy medicine, because that's what it was always like. It's no, it's not COVID. It's allergies. I promise it's allergy. So it was either allergy medicine or things like ibuprofen or acetaminophen. People would just be taking fistfuls of it because they were afraid of going to see their physician because they didn't want to put themselves at risk of catching COVID. And this was even before a vaccine came out. So I think that that's something that we can spend some time discussing this year is appropriate use, not just appropriate use of medication, over-the-counter medication, but appropriate utility of your community pharmacist as a trusted resource, a purveyor of, at least at this point in time, free medical advice that you can go and get, in some instances, 24 hours a day, 7 days a week in some community pharmacies. So there's a lot of information in that statement, Jamie, that you gave, that I think a lot of people out there could really benefit from hearing more about.
I think so too. I just learned recently in pharmacotherapeutics that people can actually misuse Imodium. I thought that was really interesting, and I didn't know that that was a medication that could be misused, and it can have very detrimental effects if people just took too much because, like you said, they didn't want to go to the doctor to get help.
Oh, yeah. I mean, so for those people out there, listeners, who do not know what Imodium, the other name of Imodium is loperamide, who don't know what that is a medicine that is available over the counter that is used to help curtail or stop diarrhea. It's an anti-diarrhea medication. And it actually works by triggering the same receptors that a medicine like morphine would. But it just so happens to be that the receptors in your gut, in your colon rather than everywhere. But yes, you can take that. And obviously we don't want people to do that. But you're right, when people, it's not necessarily intentional of, ooh, I'm going to do this, because people don't just wake up in the morning and go, you know what I want to do today? I want to take like 5 boxes of Imodium. Like, nobody wants to do that.
Right.
Sometimes the disease will make them do that. But if someone had an uncontrolled diarrhea from an infection, or maybe they just ate bad chili, like, I don't know.
Right.
And taking more than they should, here's the situation they land in.
Mm-hmm.
All right. Those were great points, Dr. Franco and Jamie. And with that, let's get into this week's show. So last year we covered the opioid epidemic in our area, substance use disorders, naloxone, harm reduction organizations, medication disposal, safe medication use, stigma reduction, and the role of pharmacists in the community as it relates to the opioid epidemic. This year we are going to continue the same trend of topics centered around the opioid epidemic, substance use disorder, and some new ones as well. This includes needle exchange programs, harm reduction techniques, events in the community, advocacy efforts, and more. We will also be discussing alcohol and how it relates to substance use disorders. And from here, we'll discuss the benefits of AA as well as Al-Anon.
When we talk about alcohol, that's another important one. Back when COVID first hit, so we're talking March of 2020, and everything shut down. One of the first things in the harm reduction world that I know myself and several colleagues started to advocate for was opening up the liquor stores, the beer distributors in Pennsylvania, because Pennsylvania just happens to have rather backwards rules and regulations. I have a friend who lives in Tennessee, and I went down to visit him once, and I walked into like a gas station, and there were just bottles of alcohol. I'm like, this is so foreign to me. But in any case, because we knew that a lot of people with alcohol use disorder potentially would go into withdrawal. And if you go into withdrawal with alcohol, you could die from that. You could have a seizure and die. And we didn't want to see people dying because the state shut down. And thankfully, the state opened up the beer distributors and the wine and spirit stores, one of the first things that opened. And while a lot of people might have looked at that as, oh, this is the state trying to generate money, or this is going to promote alcohol use. And yes, we 100% saw alcohol use go up over the last 2 years. We did realize the silver lining that we're now at least helping or providing a way to not die to people who otherwise might have if they didn't have access to alcohol to sustain it, or more impressively, a detox facility to go and get help. But yeah, you brought up AANA, getting access to those types of programs, while not for everybody, and that's fine, recovery is unique to everybody, having access to that is imperative to some people. Their whole recovery hangs on it. And when everything got shut down, it made it very difficult. And we were talking before we started the show about virtual AA or NA, NA and Narcotics Anonymous, and Al-Anon, so AA or NA for the family or friend of the individual. And, well, yeah, that's great. It lacks the feels. Now, some people benefited from it, and that's fine. But people who maybe have lacked computers or Wi-Fi, or they lost their job and lost the ability to pay for their computers or Wi-Fi, they were kind of put in a situation. So now that things are starting to open back up, more and more people are feeling comfortable going back into society. hopefully more people take advantage of the AANA, Al-Anon, whatever program, 12-step happens to be out there.
Yeah, those are some great points, Dr. Franco. And for the pharmacy students at Wilkes listening out there, shameless plug to Dr. Franco's elective, the pain elective. But he actually had us go to an NA meeting this year, and I thought it was definitely a life-changing moment. I was really surprised at just how comforting and supportive the environment was and how everyone just really gathered around each other and was just there to support everyone.
Yeah, well, first off, thank you for shamelessly plugging. I did not tell him to do that, by the way. That was of his own free will. But that's why we want people to go to these types of meetings, so you can see it's not like you would think in a movie or on TV that you would when you see AA or NA. It's not like that. There's portions of it that are true, yeah, but we'll call it this way. It's a lot of anti-social distancing. We want people to be together. There's probably a lot of hugging. Yeah, that at least pre-COVID there was hugging involved. But that's part of it. The purpose of AA or NA. It's a big bag of coping mechanisms to try to deal with stress, but it's also a community. It's where people of like experiences can go and help each other, especially people who, unfortunately, society still says are not worthy. Now, we're getting better at that, but we're not there yet. So it's a great way for people to find community, belongingness, love, hope, support, and that's all what we need to help enter recovery and sustain recovery.
Yeah, so those are some really great points. Thank you guys for sharing, and Bryce for sharing your experience with the pain elective that I plan to take in the future. So we're going to take a quick break, and when we come back, we're going to discuss more about where Bryce and I would like to take our show next. And thank you for listening to Operation Substance Use Disorder Radio. Keep it locked on 90.7 WCLH until we return.
Welcome back. You are listening to 90.7 WCLH Wilkes-Barre Grand Hazleton. For those of you just joining us, you're listening to GenRx Radio. My name is Bryce, and I have my co-host Jamie with me, as well as Dr. Franco. Dr. Franco, could you give everyone just tuning in a quick recap of the first half of the show?
Yeah, we were welcoming everybody back after our 2-year, we'll call it being sidelined for obvious reasons. But we're happy to be back. We talked a little bit about how COVID has started to impact people and sort of just setting the stage for what's coming in the future with the show.
Thanks for the recap, Dr. Franco. So we are here to bring you weekly topics centered around the opioid crisis in our community. Be sure to tune in every Wednesday afternoon from 1 to 1:30 for a new show. We are representing Operation Substance Use Disorder, an initiative through the American Pharmacists Association Academy of Students Pharmacists chapter here at Wilkes University Nesbitt School of Pharmacy, with the goal of educating everyone on proper medication use, medication disposal, substance misuse, and many other topics.
Many other topics is probably an understatement based on what we talked about at the outset. But yeah, that's going to be our focus this year, as it has been in the past, focusing in on substance use disorder and getting education out there, trying to get rid of some of the stigma and the myths that are out there, and definitely shamelessly plugging a lot of what we happen to be doing here at Wilkes along the way.
Yep. Thanks, Dr. Franco. And when looking back on what we did last year, we had a great deal of content week after week. We are going to continue the previous trend and include guests on the show from outside the university. We are able to have guests call into the show and broadcast with us via the phones or Zoom. That will at least give you a break from hearing me and Jamie's voice week after week. Dr. Franco also has colleagues from other institutions that also focus in the area of substance use disorder.
Certainly do. I think that's the really nice thing about, one, being a pharmacist and two, being involved in a rather niche setting, is that there's not a lot of people that are pharmacists that do substance use disorder work across the country, which means we all know each other. And I'm sure that those folks, if they don't know, they're going to know now, are going to be reached out to lend some expertise and some experience if they want on the show in the future. So hopefully we'll be able to hear from them. Actually just had a webinar with one of my colleagues from the University of Rhode Island last week, and it was a fantastic experience, and it's leading to more discussions that we're going to have locally about pharmacist involvement with buprenorphine. So a lot of opportunity to get some of those folks involved. And if you guys come to Utah, you will get to meet them.
We are planning on going to Utah. We're really excited. And although we love Dr. Franco, we are excited to hear from some other pharmacists as well. So earlier I hinted at how Wilkes Operation Substance Use Disorder gained regional attention. This past year, Hunter led our chapter of Operation Substance Use Disorder to a regional win, and we are very thankful to have such an opportunity. Dr. Franco, could you tell us a little bit about our win last year?
Well, I think when we talk about region, we have to talk about where exactly the region is. So the region is like, you'll call it Mid-Atlantic area. And all that means is that the work that Hunter led last year resulted in APhA, so the American Pharmacists Association, reviewing all the applications and saying, wow, you guys did the best job. And I don't think that should diminish the good work that all of the other schools are doing. Because while, yes, it's great to get a plaque, it's more important that we're all out there trying to educate people about substance use disorder. And even to back it up beyond that, we had another win, I believe.
Yes, we did.
For other people who are currently being too cool for school out in Pittsburgh and even beyond, with certain people working for three-letter drugstores, with our national win. And I think we have to discuss or at least give a shout out to the individuals involved with the national win we had a few years ago.
Yeah, I think Harrison did a really great job getting us that national win, and I sent him a picture of the trophy, and I told him I was going to keep it, but he told me I had to give it back to the school, so I was a little upset about that. But
Bryce and I are really excited to try to go after that national win again this year.
Well, it's just a testament to everything that the students here do. And you know, when we first got started talking, we talked about the legacy that, you know, Dylan and Harrison started the show, and Hunter took it to the Saturday Pharmacist and the podcast and YouTube. And how are you guys going to continue to grow it? And that legacy of success is now, you know, incumbent upon you guys. And it's great to win. That's fantastic. I know I'd like to hear Wilkes University's name read at the APhA meeting next year for this year. And if we do, great. If not, hey, we're still doing awesome work. But yeah, a huge shout out to Dylan and Harrison. Their combined work led to Wilkes winning the National Generation RX Award, which was presented remotely. So we had our show, COVID happened, everything gets shut down. The meeting goes virtual, and they do a virtual announcement, and everyone loses their mind when we found out that we won, which was a kudos to them. So congrats to them, and congrats to Hunter for a regional award. And now it's your turn. Let's see. No matter what, though, you guys are going to do awesome. I have no doubt about it.
yeah, thank you for that, Dr. Franco. It feels like we have a lot of weight on our shoulders now. But in addition to hosting these live shows, we're going to take a little bit of Harrison, Dylan, and Hunter's ideas and put them all together. So we're going to do this live show, and then we're also going to post them on YouTube as a podcast. So for all of those people listening out there, I'd appreciate it if you could go like and subscribe our videos on APhA-ASP YouTube. Also, one thing we were just talking about before we started this show, some data just came out that said from April 2020 to April 2021, over 100,000 people died from a drug-related problem. Dr. Franco, could you tell us a little bit about that?
Yeah, this is fresh information as of not even a week ago. That just in that 12-month calendar period, over 100,000 people died. And the deaths associated with fentanyl, just fentanyl, were more than the total number of deaths associated with drugs in general in 2016. And that's on top of opioid prescribing rates continuing to fall from their peak in, I believe it was 2013 or 2014. So it's yes, there's still the prescription side of things, but we now have to look at what's tantamount to a tainted illicit drug supply. And we need to find something to do with that. And that's where our colleagues in law enforcement, be it DEA or to local law enforcement, can come into play to try to curtail that. But we know that there's a lot of people out there that need help. And we know that the impact of COVID from isolation, financial issues, anxiety, stress, all of that has built up. And we're not even talking alcohol here. That's a whole nother story. But we're seeing that COVID really did it. It exacerbated what's really can be an ongoing mental health problem in this country that has been in existence. COVID just happened to shine a light on it. And hopefully more and more people and more resources can be devoted to helping to curtail the growing mental health issues in the country, in addition to the substance use conditions, which is just a subset of that, since it's a mental health condition. That subset, but there's an overarching problem that we need to address.
Yeah, so these new statistics were very eye-opening for both me and Bryce, and we definitely want to dive into this a little bit more with our future shows. But with this show, we're going to start wrapping up. And again, we are Operation Substance Use Disorder, GenRx Radio, and we are focused on promoting safe medication practices to individuals of all ages.
Yep, and before we end the show, I just wanted to let everyone listening out there know that if you or a friend are suffering from substance use disorder, that you can find treatment on samhsa.gov. This is a website Dr. Franco actually just showed us in our pain elective, but SAMHSA stands for Substance Abuse and Mental Health Services Administration, and they're committed to helping individuals with these diseases. By going to their website, you can find treatment centers close to you. Again, that is samhsa.gov, samhsa.gov.
So we encourage everyone to check out SAMHSA's website. It's a really great website. Not a lot of people know it exists, but it has information, like you said, Bryce, on where treatment is located near you, where physicians who can prescribe buprenorphine are located near you, where methadone treatment programs are located near you, as well as information for family on how to try to better handle that situation, because we all know that substance use disorder is not just a disease of the person. It is a disease that goes after everything in that person's circle: family, jobs, friends, their relationship with a higher power. All of it gets impacted. And SAMHSA has wonderful resources. So we are going to continuously plug SAMHSA as a vital resource for patients who are either in recovery or struggling to find their recovery. That is information out there available to you.
Okay, so tune in next week, Wednesday, December 1st from 1 to 1:30 p.m. And we're going to talk about the current event we discussed in the statistics and what led to the rise in some of those numbers that Bryce mentioned. So thank you for listening to GenRx Radio with Bryce, Jamie, and Dr. Franco. Until next week, let's keep it locked right here on 90.7 WCLH.